Navigating adult social care. For most people, the first contact they have with adult social care is when someone has been ill or where you or someone you know is no longer able to do day-to-day tasks and be fully independent. This inevitably has an impact on the person concerned, but also their carers, friends and family. Additional care and support can be needed short-term following a hospital stay, or something that will be longer-term, such as for a medical condition. Some people may need social care support for help with mental health problems, learning or physical disabilities. For many, there is a question of where do I start? Things may feel overwhelming at a time when a loved one is facing a significant change in their life. This video is here to help you understand more about adult social care. There is another video on supporting you to stay safe, well and independent. Whilst this is related to those leaving hospital, it provides general advice and guidance to all. Unlike the NHS, social care is not a free service. You may be required to make a financial contribution to your care and support. The contribution amount will depend on your income and personal circumstances. In adult social care, we support people to live in the place they call home with the people and things that they love, in communities where they look out for one another, doing the things that matter to them. This could be arranging for care professionals to visit you at home to help with daily tasks that may have become harder for you, using some care technology, for example, something that can alert people should you have a fall, setting up a short-term package of care after a person is discharged from hospital, installing some adaptation to your home or equipment to get you mobile, providing specific support for someone who is caring for someone else. Be informed. There is a lot of very good information out there, and you can get lots of advice from charities and other organisations about healthcare. They explain in detail about such topics as paying for care if you own a property, how to go about arranging care, financial planning including tax, debt and benefits, legal aspects and end-of-life planning. We strongly recommend that you seek independent financial advice. The Council also has a range of information on supporting you to maintain your independence. There are 5 main steps in the social care journey. Accessing support. You can make a self-referral for adult social care for yourself or on behalf of someone, or others such as medical professionals can refer you. Assessment and eligibility. This is often referred to as a care and support assessment or a care needs assessment. This is available from the Council for Leicestershire residents. The best way to do this is online and only takes about 10 minutes. But if you call us, we can arrange for a social care worker to call or visit you. The assessment will be discussed with you by a social care worker to fully understand your needs and to see if you are eligible for support from the Council. All councils follow the eligibility criteria as set out in the Care Act 2014. The assessment will be used to see what sort of support can be offered. If you are assessed as not having a care and support need that the Council will help with, then you will be given information and advice on other support you could receive from elsewhere. If you are a carer, you can also do an online carers assessment. This is a separate assessment for the carer and will help identify things such as who you are caring for, how much support is being provided, and the impact on you as a carer. Finance, contributing towards the cost of your care and support. As previously mentioned, adult social care is not a free service like the NHS, and you can expect to have to contribute something to the cost of your care and support. The Council has a care cost contribution tool on the website, so you can see an estimate of the likely costs you may have to contribute to your care without having to do any formal financial assessment. If you have a lot of financial assets, currently over £23,250, then you are likely to be what is known as self-funding. There is a short video available to explain more about self-funding. After your care and support assessment is completed, and if you qualify for services from the Council, then the next stage is to submit a financial assessment. The best way to do this is to use our online financial assessment tool, where you can provide details of your income and expenditure and send us any supporting information all in one place. A paper form can be sent to you on request. It is important for you to complete the financial assessment as soon as possible, otherwise you may find that you are charged in full for any services. The financial assessment is used by the Council to determine your contribution to your care costs. You will get an indicative personal budget, which is the estimated amount of money that is needed to meet your eligible care and support needs following your assessment. Knowing your indicative personal budget helps you to plan your care and support. The indicative personal budget will be finalised into a personal budget. This is the final cost of agreed services that will be purchased to meet your eligible care and support needs. It can be paid direct to you so that you can arrange your own care and support, known as a direct payment, or the council can arrange this, or it can be a combination of the two. However, you cannot have a direct payment for permanent residential care. You can find out more about personal budgets and direct payments in a separate video. Care and support planning to meet your needs. You will have a care and support plan that details how you will achieve the outcomes in your care and support assessment. This is not as complicated as it sounds. It simply means that you need to show these 4 main elements. What is important to you, what we are going to do to help you live the life you want, the care and support you need from others, and the services, purchased or free, that are going to be used to improve your well-being. Review of your care and support needs. There will be an annual review of your care and support plan to ensure that it is still meeting your needs and addresses any changes in circumstances. If at any point before an annual review there is a change in your needs, either in that you improve and no longer require the same level of support, or if you are finding some things more difficult to manage, then please get in touch with the council. In summary, there are lots of sources of advice and information available. If you need help, then you can get a care and support assessment. You can do this yourself or on behalf of someone else online. If you are caring for someone, you can complete a separate carer's assessment. If you are a Leicestershire resident and are assessed as eligible for support as defined in the Care Act, then you need to complete a financial assessment. You can expect to pay something towards the cost of your care, and the financial assessment is used to determine how much this is likely to be. If you are not self-funding, then you will get a personal budget based on your financial circumstances. You will have a care and support plan to follow, showing the outcomes that were identified at the care and support assessment stage. There will be an annual review to ensure things are still meeting your needs. If things change in the interim, contact the council.